Hello and welcome to an overview of the TransplantFirst Academy's Champion Patient Program. I'm really excited to introduce you to this innovative patient engagement model. What makes this program so unique is that it was developed by a kidney patient for kidney patients, and it's chock full of rarely discussed insights. We've all heard the expression, information is power, and we've become quite familiar with emerging evidence that supports patient engagement leads to improved outcomes. Is your practice offering a proactive path to better outcomes? Of course, not all patients will benefit equally from any given program. We recognize that options and outcomes will differ for each patient, just as their comorbidities, health trajectories, and attitudes differ. Yet no matter what lane your patients are in, everyone can benefit from becoming more informed and engaged, providing the information you are offering is of value to them. Simply put, patients need to know what's in it for them before they'll engage with interest and desire. Perhaps you're hesitant to offer up in-depth information. Frightening your patients away? We get that. No one likes to stir up emotional discord, though the unpredictability factor in withholding information by causing uninformed patients to be ill-equipped to cope with critical decisions and personal health commitments. If your goal is to enlighten and inspire patient engagement for better outcomes, then you might want to check out this new paradigm that replaces the current reactionary system. It's a proactive model for patient self-advocacy. Imagine if you could motivate patients to slow the progression of their disease, and make better dialysis choices, or help transplant-eligible patients seek a preemptive transplant before they require dialysis. That's what our founder did after she discovered a more proactive path. Today, she's the proud recipient of a preemptive kidney transplant from a remarkable living donor. And while she continues to be incredibly grateful for her new lease on life, she remained troubled by her concern for others. She accepted invitations to mentor other patients. She was astounded to find so many lost and left in the dark CKD patients. Most thought dialysis was required before transplant, and that transplant was more a challenge than a choice. Even transplant-eligible patients who could have avoided dialysis didn't, because they lacked the wherewithal and timeline to pursue living kidney donation when they thought they were well enough to do so. This prompted our founder to share the systems she developed for herself by becoming a lighthouse for others. Her spirited vision and the innovative curriculum she continues to develop has now become the foundation of the TransplantFirst Academy's revolutionary Champion Patient Program. This proactive program includes 3 progressively staged tracks that effectively address common barriers to optimal outcomes. Imagine interacting with patients who are actually interested in learning how to achieve better outcomes. Of course, not all patients will be able to pursue ideal options, though we believe more might if they were given a chance to give it their best shot. Any way you look at it, all patients benefit from managing better health, understanding their options, and from making well-informed decisions. Remember, information is power. Let's take a look at the program's most dynamic components by examining what's included in each track. First up is Track 1. The primary goal of Track 1 is to capture the essence of patient engagement and self-advocacy. Track 1 represents the patient's starting line. Patients are encouraged, early on in their disease continuum, to become their own best advocate by learning more, asking more, sharing more, and doing more. It's a personal empowerment experience to encourage patients to bring their voice to life. Next up is Track 2. Track 2 encapsulates an overview of common renal replacement options and expected outcomes. This module encourages patients to become their own investigative agent and life event planner. It highlights preemptive transplantation and dialysis modalities. Its sole goal is to help patients make informed decisions. Last up is Track 3. Track 3 demystifies all the unknowns and unexpected hurdles in the living kidney donor process. Never before has there been a more comprehensive how-to guidebook to help your patients share their story with potential donors. Track 3 is Bootcamp for delivering effective outreach communications to elicit curiosity, increase need awareness, and inspire potential living kidney donor interest. Invaluable etiquettes are also included to help patients explore appropriate alternatives to overzealous behaviours. In all 3 tracks, patients are encouraged to invite support partners to learn along with them and become a part of their champion advocacy team. Of course, this program would not be complete without a trainer's guide to facilitate the delivery of each patient track. The trainer's guide includes instructor overviews and lesson plan warm-ups for each track. This is your go-to book for facilitating sessions and assigning home study. So there you have it. That about wraps up our overview of this remarkable champion patient program. Of course, you can learn more about how this program can be offered in your practice by visiting the TransplantFirst Academy's website at www.transplantfirst.org. Of course, you can always contact us directly by requesting a telephone interview on our Contact Us page. That's it for now, my friends. Thanks for listening, and until next time, we look forward to seeing you on the better side of improved outcomes.